Spanish flu. The Spanish flu, also known as the 1918 flu pandemic, was an unusual deadly influenza pandemic caused by the H1N1 influenza A virus. 10 years back, we know H1N1 virus, do you know? But Spanish flu, it was time of 1918. Lasting from February 1918 to April 1920, it's nearly 2 years. It infected 500 million people, about a third of world population at that time, in 4 successive waves. Death roll is typically estimated to have been somewhere between 17 million and 50 million, making it one of the deadliest pandemics in human history. The observation of illness and the mortality were documented in the United States, especially if you Fort Riley, Haskell County, Kansas, as well as in New York City, France, Brest, Germany, and the United Kingdom. The maintained morale World War I census minimized these early reports. News were free to report the epidemic effects in neutral Spain, such as the grave illness of King Alfonso XIII and III, and these stories created a false impression of Spain. Yes, especially hard this gave rise to the name Spanish flu. Historical and epidemiological data are inadequate to identify the certain the pandemic geographic origin with a varying views as to its location. Most influenza outbreaks disproportionately kill the very young and very old, and a higher survival rate for those in between. But the Spanish flu pandemic resulted in a higher than expected mortality rate of the young adults. Scientists offer several possible explanations for the high mortality rate of the 1918 influenza pandemic. Some analyses have shown the virus to be particularly deadly because it triggers a cytokine storm which ravages the stronger immune system of young adults. In contrast, a 2007 analysis of medical journals from the period of the pandemic found the viral infection was no more aggressive than the previous influenza strains. Instead, malnourishment, overcrowded medical camps and hospitals, and poor hygiene, all exacerbated by the recent war, promoted bacterial superinfection. The superinfection killed most of the victims, typically after a somewhat prolonged deathbed. In 1980, Spanish flu was the first of the two pandemics caused by H1N1 influenza A virus. The second was the 2009 swine flu pandemic. See, along the geographic origins known, the disease was called Spanish flu from the first wave of the pandemic. Spain was not involved in the war, having remained neutral and had not imposed wartime censorship. Newspapers were therefore free to report the epidemic effects, such as the grave illness of King Alfonso XIII, and these widely spread stories created a false impression of Spain, especially hard hit. Alternatively, names were also used at the time of pandemic, similar to the name of Spanish flu. Many of these also alluded to the purported origins of the disease. In Senegal, it was named the Brazilian flu, and in Brazil, the German flu, while the Poland it was known as the Bolshevik disease. In Spain itself, the nickname for the flu is Naples Soldier, was adapted from the 1962 operetta. The song Forgetting of one of the liberators equipped the play most popular musical number Naples Soldier was catchy. The flu. Today, however, the Spanish flu is the most widely named used pandemic in Spain. Other terms for this virus include the 1918 influenza pandemic and the 1918 flu pandemic, or variation of these. Coming to the history, first wave of the early 1980s, the pandemic is conventionally marked as having begun March 4, 1918, with a recording of the case of Albert Gitchell, an army cook at Camp Funston, Kansas, United States, despite there likely having been cases before him. The disease had been observed in Haskell County in 1918 January, prompting a local doctor Loring Minor to warn the U.S. Public Health Services academic journal. Within days, 522 men at the camp had reported sick. By 11 March 1918, the virus had reached Queens, New York. Failure to take preventive measures in April-May was later criticized, and as the US had entered World War I, the disease quickly spread from the Camp Funston, a major training grounds, a troop of the American expeditionary forces to other US Army camps and Europe, becoming an epidemic in the Midwest, East Coast, and French ports by April 1918, and reaching the West Front by the middle of the month. It then quickly spread to the rest of the France, Great Britain, Italy, and Spain, and in May reached Rakla and Odessa. After the signing of the Treaty of the Brest-Litovsk, Germans started releasing Russian prisoners of the war, who then brought the disease to their country. It reached North Africa, India, and Japan in May. As soon as after he had likely gone around the world, as there had been recorded cases in Southeast Asia in April. In June, an outbreak was reported in China. After reaching Australia in July, the wave started to recede. The first wave of the flu lasted from the first quarter of 1918 was relatively mild. Mortality rates were not appreciably above normal. In the United States, 75,000 flu-related deaths were reported in first 6 months of 1918. 63,000 deaths during the same time period in 1915 in Madrid, Spain. Fewer than 1,000 people died from influenza between May to June 1918. There was no reported quarantine during the first quarter of 1918. However, the first wave caused a significant disruption in the military operations of World War I, with 3/4 of French troops, of the British forces, and over 90,000 German soldiers sick. And coming to the second wave began in the second half of the August, probably spreading of Boston, Freetown, Sierra Leone by the ships from the Brest, where it had likely arrived the American troops of French recruits for the naval training. From the Boston Navy Yard and Camp Devens, later renamed Fort Devens, about 30 miles west of the Boston. Other U.S. military sites were soon afflicted, as were the troops began transported to Europe. Helped by the troop movements, it spread over the next 2 months to all North America, and then to the Central and South America, and reaching Brazil and the Caribbean on the ships. From Freetown, a pandemic continued to spread through West Africa along the coast, rivers, and colonial railways, and from the rail heads to more remote communities. South Africa received it in September on ships, bringing back the members of South African native labor camps, crops returning from the France. From there, it spread around southern Africa and beyond the Zambezi, reaching Ethiopia in November. The Philadelphia Liberty Loans Parade, held in Philadelphia, Pennsylvania, on 28 September 1918, to promote to government bonds for the World War I. Result is in 12,000 deaths after a major outbreak of the illness spread among people who had attended the parade. From Europe, the second wave swept through Russia in southwest, northeast, diagonal front, and as well as being brought to Arkhangelsk by the North Russian intervention, and then spread throughout the Asia following the Russian Civil War and the Trans-Siberian Railway, reaching Iran, where it is spread through the holy city of Mashhad, and later India, September, as well as China and Japan, and Japan in October. The celebration of Armistice of November 11, 1918 also caused outbreaks in Lima and Nairobi, but the December wave the mostly recover. It's later it's a third wave of 1919 also. Third wave means January 1919, and fourth wave 1920. It means springtime 1920. Despite its name, historical epidemiological data cannot identify the geographic origin of the